Kenya, Malawi, and four member states, Kenya, Malawi, Niger, and Somalia. And when we look at the trend over the last 2 months, we see that there has been almost 60% increase in the number of new cases since the beginning, since 2 months back, since the beginning of September. This is, of course, a big concern because we, at the same time, we are seeing flooding in certain parts of the continent. The rains are coming, and if we don't have cholera under control with those conditions, the numbers could be able to go up. But we are working very closely with the affected countries to ensure that we are identifying quickly, managing and isolating those who have cholera so that we avoid any spread. And cumulatively, since the beginning of the year, cholera cases, we've documented 54,884. And we have unfortunately lost 926 individuals across 14 of our member states during this year. And this is the sad reality is that 1 out of every 10 people who are affected by cholera are actually dying from it, something that we are working hard to reverse. 14 of our member states have been affected, and we continue to work very closely with these member states to strengthen surveillance, ensure that the public have good information, and manage any cases that are identified. So these are the 5 main public health events that I wanted to share today. Some quick announcements. One is the Conference of Public Health in Africa. Registration is open. Let us encourage as many as are interested in public health as possible to attend. We would like to have full house. We have planned for 5,000 individuals in Kigali this year, 13 to 15 of December. And registration is open. So let us get as many of us as possible to be in Kigali in December. Secondly is we had also made an announcement for the Bingwa initiative, young people in the Eastern Africa region. Very good turnout. We closed this application portal on Monday, and we have received over 1,700 applications. And the next steps now is to select the 100 that we are going to then train and then deploy immediately to their communities to be the champions for not just COVID-19 vaccination, but all other health activities that the communities need to be engaged in. Thirdly is next week on the 11th of November, under the auspices of His Excellency President Hakainde Hichilema, the President of the Republic of Zambia, we will have a regional launch of the Saving Lives and Livelihoods program for the Southern Africa region, and that would be in Kampala. That would be in Lusaka in Zambia on the 11th of November. So there's a lot that is going on the continent as far as public health is concerned, and we would like that we continue to keep up with each and every one, not just the easy to report ones like Ebola, but there's a lot that is going on the continent, and we appreciate your support to ensure that we keep securing the health of Africa. Thank you very much, and back to you, Wayne.
Thank you very, very much, Ahmed, for that detailed breakdown of the situation of the public health on the continent of Africa. So now, colleagues, we have come to the Q&A section. I am not currently seeing any questions, so perhaps I could just give you the numbers for you to send in your questions again. And so the WhatsApp number is +251 94 550 2310. That's +251 94 550 2310. But you can also join us live on this platform, or alternatively, you can send in your questions through the question and answer section. All right, so while we are waiting for your questions to come in, perhaps let me just ask Ahmed about this reported new strains of COVID-19 that are capable of evading the immune system, if I remember correctly, and therefore may not be very responsive to vaccines. Do you have a comment on that?
Thank you, Wayne. There are reports of that. We are waiting for confirmation to see what kind of variant it is. As you know, when a new variant comes, we study it, we understand it, and then we can be able to respond to it. When we look at the numbers across the globe, we at the moment do not have evidence that there is any large-scale active evading of vaccines. Indeed, the numbers have remained relatively stable. But we are going into the cold season in the global north, and we are also waiting to see how that will affect transmission. Secondly is we have also seen reports of mixed infection, and we are also waiting on data to confirm if the mixed infection is having any effect on the transmissibility within the population, and if at all, it is also having any effect on the defenses we've already built as a result of vaccination. At the moment, we await the evidence because we do not have enough information to be able to give you concrete feedback on truly are they evading vaccine protection or not.
All right. Thank you, Ahmed. We have a question from Lucia Blanco, who is with the International Spanish News Agency, EFE. Lucia says, I wanted to ask you if Africa CDC is present on the ground in Tigray, providing assistance, and if so, what is the medical situation that you are seeing there?
No, thank you, Lucia. We were in Tigray before the conflict. When the conflict began, we pulled out our teams from there, and therefore we are not at the moment in Tigray. We are, however, very pleased to note that a peace agreement has just been signed, and as soon as the situation allows, we will be sending back our teams to the ground, because there's a lot of public emergency issues to be able to deal with there. At the moment, we are not on the ground.
All right, thank you. The next question comes from Gemma Ritchie, and Gemma says, has immunization for children improved since the COVID-19 restrictions were relaxed? And she goes on to ask, where can we find data on the immunization of children across the continent? That's Gemma coming through our WhatsApp platform.
No, thank you, Gemma. For good data on immunization of children on the continent, UNICEF will be the best place to get the latest data. In as far as improvement are concerned, in immunization after the movement restrictions. Indeed, yes, there has been improvement in that. In fact, what we are seeing now are the effects of the pandemic, where many children did not get their doses of various types of vaccines at the right time. And that's why you see there was a sudden increase in the number of measles outbreaks, for example, on the continent, which continue. And this is a direct effect of health services not being made available at the time that they were required for many of these children during the height of the pandemic. After the restrictions were lifted, there was better movement back into the health facilities, and more and more children are actually getting their regular doses of vaccines, and therefore the immunization programs have picked up again. Our intention is to put in place plans and mechanisms into the future where, if there is a health emergency, the regular immunization programs do not get affected. We'll try and secure those, because it opens up another front for vaccine amenable diseases to rise again if we don't get the children immunized in time. But for current data, please check with UNICEF.
All right. Thank you, Ahmed. We don't have any more questions. Colleagues, I'm just going to give you about 30 seconds to a minute. If you have questions that you want to put through, please come through on our WhatsApp number, +251 94 550 2310. You can also come through live or use the question and answer section. All right. We don't have any questions coming through, including our WhatsApp platform. So I think I'll give the floor now to Dr. Ahmed to just summarize on the key points that you would like. All right, James Macharia Chege has just come through. And James is with Reuters in Johannesburg. He says, could you clarify that you had pulled out of Ethiopia or just the Tigray region?
Thanks, James. Our secretariat is based in Addis Ababa in Ethiopia. We are very much present in Ethiopia, all the regions that the government has asked us to support. We only had pulled out our presence in the Tigray region where there was a conflict. But the rest of Ethiopia, we are present and supporting the government as per request.
Okay, I think that is our last question. So please give us your main points for today before we close this session.
No, thank you. Thank you very much, Wayne. Today, I would like to give two messages. One is on the Ebola virus disease outbreak, the Sudan strain that is currently in Uganda. For this, I would like to say that one, the situation is not only under control, but we are also strengthening the rest of the health system to ensure that as soon as we bring this under full control and we declare it over, then the health system will remain to be able to handle any other outbreaks that may come into the future. So we are taking the opportunity of the outbreak to identify gaps, strengthen systems. The second thing about this particular outbreak in Uganda is that the experience that we are gathering in Uganda, we are using in neighboring countries, strengthening their surveillance system, strengthening their community engagement, strengthening their risk communication, and also ensuring that they have deployable experts, if at all it will be needed, not just for Ebola, but for any other rapidly spreading outbreak. So we are using the Ebola virus disease outbreak in Uganda to strengthen their health system and also prepare the rest of the countries in the neighborhood for any other similar type of outbreak. So this is very important that we are not addressing only one outbreak. We are using this to build a system like we have done in the DRC and elsewhere. Second message for today is about COVID. We had set ourselves a target of 70% by the end of the year. We are very aware that we are only at about 25%, and we are doing everything we can to try and get as close to 70% as possible. And tied to this is launching innovative ways of getting to the public, including the Bingwa initiative, the mass campaigns, the door-to-door campaigns that we are doing. And we are also using the opportunity of the Saving Lives and Livelihoods initiative to strengthen the systems for immunization at country level. We are not only getting the vaccines into arms, we are also ensuring that we have cold chain facilities across each and every country. We are ensuring that we have trained health workers who tomorrow will be used for any other vaccine amenable disease. We are ensuring that the plans and systems are in place all the way from the central part of a country's Ministry of Health all the way down to the community level. And that system can and will be used for any other outbreak into the future. So in this way, these two active programs that we have for Ebola virus disease and also for COVID, we are using it to strengthen systems at country level. And this is very much in line with our new public health order, where we want to strengthen our institutions, build capacity of our healthcare workers to ensure that we have a very strong public health system that can be able to respond to any health emergency into the future. So these are the two things that I wanted to reaffirm today for everyone on the platform. Thank you very much.
All right. Thank you very much, Ahmed. That was Dr. Ahmed Ogwell, who is the Deputy Director of the Africa Centers for Disease Control and Prevention, the Africa CDC. Colleagues, I want to thank you very, very much for having joined us, and also to thank all the colleagues from the African Union and from the Africa CDC for their work behind the scenes. But for now, I think it is time for us to say goodbye and say let's meet again next week on Thursday at the same time, which is 12 noon East African time. Bye-bye for now.
Thank you.